Many of our men struggle with four major silent killers: heart disease, high blood pressure, stroke, and diabetes. Here to educate us on these issues is cardiologist Dr. Raya of Capital Cardiology. I got that right. He practices at Doctors Hospital, Prince George's Hospital, and other area facilities. We also have Millicent Edgar. She is the stroke coordinator at Prince George's Hospital. She's an RN. I'm so glad to have her. Also with us is Larry Bussell. I am so glad that you all are here with us. This is such an important topic, so I would just want to go right at it. We heard Larry's story, you know, at the top of the segment, and wow.
That was amazing.
Yeah. Yeah, I think my case is typical of most men. We think we know more than the doctor. You know, the doctor laid out a treatment plan for me, and I said, well, I just do more of the exercise and less of the eating right. And
so
I
that
think
was your adjustment, right? In other words, you thought that you could counter it with exercise, but not make the adjustment to your eating habits.
Correct, correct.
And that's a good point. I've seen a lot of patients where, let's say they have high cholesterol. They'll say, okay, I'll get the pot roast, but I'll put on a Lipitor and I'll be fine, you know? They try to balance it out. Or,
wow.
Oh, I love chocolate cake. I love chocolate mousse. Let me add a little extra insulin. Boom, I'm okay.
Wow.
Yeah.
So they try to just sort of justify the discretions a little bit, the dietary discretions with a little bit of extra medication. They think it's going to balance out. But in the end, the only one who's going to pay for it is the patient themselves.
So you've got some models over there, but when he talks about blockage, like they rushed me to the hospital because I had 90% blockage in my right artery. You got anything you can show us and talk about where that is and why that
Tony,
happened?
first of all, I'm going to show you these models, but I want to thank you and our other co-host here for really bringing this topic out. It's one of my passions, and I like to really educate the population on this topic.
Excellent.
And I think prevention, I mean, yeah, we can do all the fancy bypass and we can do the stents and we can do, all these new fancy medications, but literally, I mean, it's about basics, it's about prevention.
Common sense.
It's about knowing your body, and it's about going to the doctor, it's about listening to the wives. And I think that's what it's about. So,
and we're glad to have you here too.
So,
and that's great. That's great to hear from a doctor. And before you show us the models, just since we're here,
sure.
So I don't quite understand, because I had a heart attack and a triple bypass operation. You specialize in stroke.
Absolutely.
Tell us the difference between the two, if you can. And I know it's a big topic in a short period of time, but what's the difference between the two?
Actually, a stroke is a brain attack.
Wow.
Yes. So what happens during a stroke, you can either have an ischemic stroke where there's a blockage, or a hemorrhagic stroke where there is a bleed. There's actually a leakage or a rupture in the vessel. So the stroke happens in the head, and then in your heart attack, you're having the attack in your heart.
I didn't know that.
Yeah.
Did you?
Yeah, I think I understood. So what's the deal with people, something happened to their left or right arm? I'm always figuring out, every time I get numb, I'm like, which one arm is that?
Yes, and what happens if a person experiences a stroke, let's say on the left side of their brain, it normally sometimes will affect the right side of their body.
So it's no one side?
That's correct. You can actually, either side, it could be left side or the right side.
Okay.
Yes.
Okay.
And so if someone has a stroke on the left side, it can affect the right side of their body. They can have paralysis, of course, slurred speech, vision loss, confusion.
Now, if you're having a heart attack, does the same thing happen, not in terms of, is there a side, we're just trying to get the common information out. So is there a side that if I'm numb on the right side, then I'm having a heart attack? Because obviously if I lose motor functions, it's a stroke, but a heart attack, is there a sign for that?
Tony, that's a great question. I wanted to sort of just take a few steps backward, though. We're all talking about all these different diseases, including, we're talking about heart attack, right? And we're talking about stroke. But it's all the same spectrum, really. It's a plumbing issue. Let's put it back. This is what, Father's Day coming up?
Yeah, absolutely.
Hey, the men are the plumbers, right?
Right, okay.
It's a plumbing issue, to be honest with you. So either poor flow to the brain causing the stroke, or it's some piece of the wall from cholesterol plaque just shooting up there and then causing poor blood flow to that area, causing the actual stroke.
Yeah.
So, and then I'll segue into this the heart the heart project here. So the heart is like a strawberry. Okay, so that's a good way to think about it, and that's how I tell my patients about it. If you look at the triangular shape like this, now the heart is usually located on the left side of your body, and it's sort of pointed this way. The tip of the strawberry is pointed this way. And we have 3 main blood vessels that supply the heart. You got the left anterior descending artery. It's just basically a vessel at the top of the heart. You got your right coronary artery here, and you got your left circumflex artery here. You mentioned, I think, the right coronary artery as one of your arteries that was affected.
Yeah, I had a blockage in the right.
And
so where is that? Show me that on the model.
So the right coronary artery comes down right here and comes to the right here.
Okay.
And so why is this all important? Why are we even talking about this? Well, the heart is an engine. It's a pump. And really the blood vessels supply this engine, and it keeps us going. And if I can take a minute and show you, let's say we take one of your blood vessels, your blood cells, and we take a little slicer, like cutting a slice of cheese here. This is the blood vessel in cross section here. Okay. So this is what God gave us, right? This is a beautiful blood vessel, juicy, open. You can drive a semi through this one, right?
Okay.
Then over time, I love the analogy about the quarters. So, so second quarter, right? You're not doing the greatest. You're doing a lot of beer, a lot of cheese, a lot of other things. So you get some cholesterol accumulation. Third quarter, boom. Now you're getting significant, this is like 70%, 80% occlusion. And so this is when people start having chest pain. Now, not everyone has chest pain. I want to address your concern about, hey, I know the symptoms of heart attack. How come I didn't get that?
Yeah, because I'd felt nothing. And I wanted to ask you about that. So is and let me ask you this quick question.
Sure.
Is that the contribution to that? Is that because of my diabetes, or is there something else that kept me from?
You have a wise husband.
Yes.
now I'm wise.
So diabetes is of all the silent killers, diabetes is like an assassin. Okay.
Wow.
So.
Say that again. An assassin.
Yeah,
wow.
Diabetes is an assassin, okay? And I wouldn't give my worst enemy diabetes, to be honest with you, because it affects so many things. And I'll get to that in a second. But going back to the heart attacks. So diabetes numbs different parts of your body. It kills nerves. It can kill your nerves in your feet. And that's why the most common cause of amputations in this country is not Iraq or Afghanistan. It's diabetes. And it also causes kidney failure. And the most common cause of dialysis is usually diabetes or hypertension. And it can also cause blindness in the eyes. And now we're not even got to the heart, but getting to the heart, it can numb or deaden the nerves to the heart. So the chest pain is God's way of like warning us. But diabetes circumvents that and then kills all those cells. So you may be having a heart attack and you don't know. You may have all these subtle symptoms.
I didn't know. And that's the key to this whole thing is, and the reason we're really doing this much of this show is because I did not know. And I could have gone to sleep that night or taken, you know, some Motrin or something thinking I was handling my business and died in my sleep. So the pain thing, I'm glad that you brought forward. I wanted to ask Larry a question because you had stents and then that didn't work out, and then then you had you had triple bypass, correct?
Right.
And so
at age 42, I had when I initially had chest pains, I had an angioplasty with the stent implant. 8 years later, the problem reoccurred because I didn't do the right things. I didn't manage my risk factors.
Can we say cookies?
Yeah, I love cookies. Yeah, and this time it was more severe, because it was in the middle of the night. I was asleep, had problems with breathing, chest pains, and I think it was the 4th of July weekend.
Wow.
So it really took the medical people a long time to respond. And so I just kind of sat on the couch and I held my chest, took a bag and tried to, do my own resuscitation. I was doing a lot of things.
If I could sort of make a little comment there. You did the right thing by contacting the EMS. The next thing I'd recommend, if you have these symptoms, and you may have the classic ones or the non-classic ones, as Tony was mentioning, immediately take 2 baby aspirin with water and call EMS, call 911, call your wife. If
Call
so, if
somebody.
there's something going on, call your neighbor.
Call somebody.
Either get to the hospital or get someone to take you to the hospital.
Right,
But the 2 aspirin is one of the lifesavers. Even though we've come up a long way with all our advances in medications, even for stroke as well as heart attacks, aspirin is one of the best medications you can take to at least alleviate or mitigate some of the severe effects of our diseases.
I just got a question right there because I'm going to be honest with you. When this happened to my husband, I went and bought me some aspirin. But then I found out that, now nobody told me, the doctor didn't tell me to go get an aspirin, but I was like, hey, the aspirin saved his life. And then I found out aspirin can operate as a blood thinner.
Right.
That's correct.
And nobody knew I was taking that. So then I stopped. So the thing is that something that we should just do, or is that something we should be talking to our doctors about? How does that work?
You can speak with your doctor about it. Sometimes it depends on what your comorbidities are. If you have...
Wait.
So what is that?
I'm sorry.
This is Miss Deborah's Tearoom. Comorbidities, what is that, honey?
If you have high blood pressure, high cholesterol, or diabetes, sometimes your physician or your nurse practitioner may suggest that if you're 35 and over, and hopefully you're not smoking, if you take one aspirin, 81 milligrams a day, every day.
That's the baby aspirin.
The baby aspirin.
And that's kind of okay for everybody.
Well,
not everybody.
Unless you have problems with your stomach, and then you can get an enteric-coated aspirin.
Okay.
That's just to protect your stomach.
Gotcha.